my name is Claudia Benavente. We're here at the University of California, Irvine in Orange County, and my lab predominantly focuses on childhood solid tumors. There are aspects of cancer that have improved tremendously. Our ability to detect mutations is now without par, since we now, there's something called the Human Genome Project that was finished in early 2000. And so now we know exactly what are the driving mutations for many of the cancer types. And in other ways, we have advanced very, very little. In the cancers that I predominantly work in, because they're so challenging, because they're so rare, we've advanced very little. We're still treating many children with cancer the same way that we were treating them in the 70s. So depending on the type of cancer, it has really gone from this ideal that we're being diagnosed with this cancer is no longer a death sentence, it's quite easy and quite treatable, to some cancers where we still have a long way to go. The biggest challenge with cancer is that cancer is a word that we use to define hundreds of diseases. And each one of those diseases has to be treated in a unique way. And quite often, the same disease in two different individuals has to be treated differently. We need to treat the person, not the disease. And so things like the Anti-Cancer Challenge funds are fundamental for us to be able to generate that lower level research to say, yes, this is a good idea. Now we have enough evidence that it's a good idea, and to go out to reach out and to get those multi-million-dollar grants. Without this, we would not be able to be catapulted into driving novel ideas. Every time we move along and we find the way of treating one cancer, then we are up to the next. And we're working every day to put ourselves out of a job. And that's my goal in life. I am not the kind of person who runs. I often joke that if you see me running, run along with me because I'm escaping from something. But I like to twist that, and if you see me running, it's for a very good cause. And when I participate in the Anti-Cancer Challenge, it's a great cause because we are helping drive new discoveries and drive ways of making the prognosis of patients afflicted with cancer here in Orange County a little bit better by fundraising. This is an absolutely fun event for a great cause, so you should join us and be part of this, not just this year, but every year, and help us make this place an anti-cancer place.